Okay, well, hello everyone. Thank you for joining our webinar today. We first wanted to introduce ourselves. My name is Matt Peterson. I'm a relationship director with MapleLMS. I work very closely with our clients at MapleLMS to partner with them on training, educational, and professional development programs and help them achieve their objectives around their education programs. Joining me today is my colleague, Aben. Aben, how are you today? And you'd like to tell us a little bit about your role at MapleLMS?
Thank you, Matt. I'm doing good. My name is Avin. I'm a key account manager with MapleLMS. I'm also the customer training manager, and I mainly handle client onboarding. So I train them on our platform and everything around that.
Perfect. Nice to have you with us. Before we get started, just a couple of housekeeping items. We encourage you to ask questions through the Q&A at the bottom of your screen, and we'll be happy to answer them at the end of the presentation. Also, MapleLMS is a certified CAE provider, and today's live call is eligible to receive 1 CAE credit, which can be claimed on the American Society of Association Executives website. Today, we'll be talking about how an LMS supports continuing education for healthcare professionals. We're going to be discussing how an LMS helps to manage, deliver, and track continuing education for professional healthcare associations or healthcare organizations. We'll be covering why healthcare professionals need continuing education, the challenges in providing education, the objectives for continuing education in healthcare, and how an LMS can meet those challenges and objectives and the advantage of delivering the education using an LMS. We'll also be sharing a short demo of the most sought after features in an LMS to support this continuing education. So first, we're going to talk about why do healthcare professionals need continuing education. Can go to the next slide, yeah. The first thing would be to stay current with advancements. So medical research and technology are continually evolving, and it's crucial for healthcare professionals to stay updated with the latest developments to provide the best possible care to the patients. To maintain certification and licensure, so many healthcare professionals are required to complete a specific number of continuing education hours to maintain their certification and licensure in their region or state. Failure to meet these requirements can lead to the loss of credentials and the inability to practice. Third, and probably one of the most important ones, is to really improve patient outcomes, right? That's what we're all focused on. Continuing education enables healthcare professionals to improve their knowledge and skills, leading to better patient outcomes. With updated knowledge, they can identify and address potential health issues more effectively, leading to improved patient care. Also, to enhance job performance, continuing education can help healthcare professionals acquire new skills and techniques that can improve their performance. By staying updated with the latest medical practices, healthcare professionals can deliver better care and provide more value to their patients and their employers. It can help them meet challenging regulatory requirements too. Healthcare regulations are continuously evolving, and continuing education helps professionals stay compliant with new regulations and requirements. So, Aben, I'm going to turn to you. What are some of the challenges of providing continuing education for healthcare organizations?
Right, Matt. And so the challenges can vary depending on the whole healthcare organization and its specific circumstances. However, based on the importance and prevalence of the challenges, the following that you see on my screen could be considered as the top 4 challenges that I would say. Firstly, it's about maintaining regulatory compliance. And healthcare organizations must ensure that continuing education meets regulatory and accreditation requirements, which can be challenging and time consuming. And since we're talking about time consuming, time constraint is also one of the biggest challenge, where healthcare professionals have a demanding work schedule, and which can limit their availability to attend continuing education programs. Also, oftentimes you might see staff or member disengagement, And healthcare organizations, they always try to provide engaging and relevant educational content to motivate staff and members to participate in continuing education programs, which can be difficult to achieve. And lastly, I would say one of the challenges is about budget. So continuing education can be expensive, and healthcare organizations may not have sufficient budget to provide comprehensive education programs. And certainly, budget constraint is one of the challenges. So these would be four top challenges on my list that I see a lot. And on that note, we can also look at some of the objectives of healthcare training in continuing education. And the objectives of a healthcare training in continuing education can vary based on specific needs of healthcare organizations and their staff. However, some common objectives of healthcare training in continuing education include examples around enhancing job performance, improving patient outcomes, staying updated with healthcare advances, and meeting regulatory and accreditation requirements. So if we look at enhancing job performance, healthcare training in continuing education can help healthcare professionals acquire new skills and techniques that can improve their job performance. And this objective is essential for healthcare organizations to improve the quality of care they provide and to increase staff efficiency. Also, improving patient outcomes is definitely a big objective, and it's one of the primary goals for healthcare training in continuing education, and that is to improve the patient outcome. This objective is crucial for healthcare organizations to provide the best possible care to their patient. And then healthcare professionals need to stay up to date with the latest advancements in medical technology, research, and practices to provide the best possible care to their patients. So, staying updated with healthcare advances is also a critical objective for healthcare professionals to remain current with their knowledge and skills. And lastly, healthcare organizations must comply with regulatory and accreditation requirements, which often include continuing education for their staff. Now, this objective is crucial to ensuring that organizations remain in compliance and maintain its accreditation. And Matt, you engage with so many healthcare associations. Could you talk a little bit about how healthcare learning management systems help in continuing education?
Absolutely. Thanks, Haven. I would say one of the first things I wanted to talk about is reporting to accreditation bodies. So ACME, if an organization is accredited by ACME, there's annual reporting requirements due to them if you're providing any CME credits or CNE credits. And that happens through a system called PARS. So an LMS can be synchronized or integrated with that so it can directly communicate with the PARS, and that reduces the requirement for staff to input the data through manual data entry or batch upload methods. The ACME and PARS simplifies CME distribution with a flexible system that lets you upload data in bulk for multiple continuing medical education activities all at once. It automates that ACME reporting and increases CME compliance without ever leaving the LMS. Alternatively, a customized report could be created within the system to meet ACME requirements that can be easily downloaded and uploaded to the ACME parse system for the end of the reporting. More on a manual basis, but you're not at least entering all that information to a spreadsheet. The LMS will take care of that for you. Along the same lines, CME and CNE reporting, several healthcare LMSs comes with the advantage features such as PARS compliant analytics and integrate with ACME web services. It thus enables generating certificates that displays their continuing education credits, including CME, CNE, and CEU based on the learner's results. CEU is a measure of how much continuing education you've completed. One CEU is equivalent to 10 contact hours. Therefore, 10 hours of CME or CE earns you one CEU credit. CE lasts the duration of a health professional's career and is therefore the model of learning that spans the longest period. It really serves two functions: maintenance of current practice and translation of knowledge into practice. And CEU credentials can be visualized on a dashboard of the healthcare LMS or within a learner's profile or transcript. And LMS enables capturing and automating regulatory compliant audit trails as well. Healthcare professionals can showcase their certificates, their rewards, their CME and CNE proofs, and course credits that have been earned on the LMS dashboard or within their profile or transcript. They can import certificates and rewards from external sources, and they can share them for better opportunities in the future. And claiming credits earned outside of an LMS can also be facilitated, so you're tracking everything in the LMS. And that's the next point: tracking progress and performance. Healthcare LMS platforms can track healthcare professionals' progress and their performance, providing insight into their learning outcomes and identifying areas for improvement. This can help to ensure that the healthcare professionals meet their learning goals and that the organization achieves its learning objectives. It also can provide personalized learning. So healthcare platforms can offer a personalized learning experience based on the individual learning needs and the preferences of healthcare professionals. This can help to optimize the learning process and ensure the healthcare professionals acquire the knowledge and skills they need. And the personalized learning can be achieved by a user creating an individual learning plan based upon those needs. And along with that comes the competency-based education. So competency-based education combines an intentional and transparent approach to curricular design with an academic model in which the time it takes to demonstrate competencies varies and the expectations about learning are held constant. Healthcare professionals acquire and demonstrate their knowledge and skills by engaging in learning exercises, activities, and experiences that align with clearly defined program outcomes. So the major goal of a competency-based learning is to demonstrate skills in any particular matter before passing on to the next steps of training. So an individual learning plan could then be created to ensure proficiency in those competencies. So the whole idea is that you may take some pre-assessments to determine if you're meeting and proficient in these competencies, and then based on any competency gaps, turn to creating a curated individual learning plan to ensure that the healthcare professional meets all those competencies. Another great tool is enabling collaborative learning. And I know ACME really supports this. Healthcare LMS platforms can facilitate collaborative learning, allowing healthcare professionals to interact with their peers, instructors, and also subject matter experts to exchange knowledge and insights. Collaborative learning can promote engagement and help healthcare professionals develop their skills and knowledge. A great way to do this is to integrate a web conferencing system like Zoom into your LMS account for live virtual collaboration meetings. And another way is to create forums and courses in your LMS to encourage discussion around a course or also a topic, and allow individuals to submit additional resources so all learners will benefit. Also, it can handle compliance training. Healthcare compliance training subjects are tailored to suit each healthcare professional depending on their job role. What this means is that not every employee or healthcare organization receives the same compliance training. It will vary from job to job. The compliance training holds a great importance to the healthcare professionals as it keeps them updated with the valuable information. The training is focused on protecting healthcare professionals by keeping them educated about the rules and regulations of their job, and learning about the rules and regulations can better allow a healthcare professional to stay in compliance and report situations in which non-compliance occurs or situations in which non-compliance has the potential to occur. Since requirements can change, an LMS allows you to update materials easily and quickly and provide notification to a learner about those changes directly in the system and through notifications. Another great tool is that this becomes a centralized learning resource center. So healthcare LMS platforms can centralize all the learning resources, making it easy for healthcare professionals to access education and training materials from a single location. And this can save time and improve the efficiency of the learning process. Next, I want to turn to how do healthcare learning management systems support continuing pharmacy education. So when we talk about healthcare professionals, we include physicians, surgeons, nurses, nurse practitioners, dentists, physical therapists, occupational therapists, medical assistants, medical technologists, psychiatrists, social workers, and many, many more public health professionals. So we at MapleLMS recently onboarded a professional pharmacist association, which had some needs special to the pharmacy profession. So the Board of Pharmacy's specialties synchronization and CPE monitor synchronization, the learner's data on the LMS gets synchronized to those two governing bodies, utilizing the learning's enrollment ID number, date of birth, and month of birth. Thus, the learning progress with their earned credits gets updated on the system, onto those two systems automatically, and reduces the amount of manual work required. CPE credits and recertification reporting. So those who pursue continuing pharmacy education on an LMS and have earned credits or recertification based on their learning progress or assessment qualification can view their credits and recertification on the LMS dashboard. Aiden, I think you had some thoughts about a few more additional advantages of an LMS as it relates to healthcare training that you'd like to share.
Yeah, absolutely. And I mean, there are a few more advantages, three of them that I've highlighted on my screen. Definitely compliance with medical policies and laws such as HIPAA is one of the big things to have, one of the big advantages. There are, I would say, not many LMS systems who are compliant, who have a lot of compliance and adherence to medical standards such as HIPAA, medical policies and laws. Just reduces the risk, reduces the compliance risk, and encourages healthcare professionals to pursue CME and CNE for better patient care. And an LMS that complies with HIPAA ensures the protection of patients' data from unauthorized access by a third-party system or by any third-party identity. And on top of that, definitely mobile learning is one of the great advantages to have. An LMS that supports mobile learning apps on mobile learning or maybe mobile learning apps on a variety of devices facilitates training on the go. And there are several LMS mobile applications that allow for offline learning. It enables access to learning materials via mobile application without requiring data connectivity. And mobile learning is inexpensive, interactive, and adaptable, and simply makes learning more accessible and measurable. So that's definitely one of the big advantages of a healthcare LMS, which supports mobile learning. And lastly, with many LMS systems, I mean, there are quite a few that I've seen, but with a few LMS systems, what you would find is an option to download and share any earned certificates or certifications. And basically, those who successfully complete the prerequisite conditions, such as finishing a specific course or activity, can view and download their earned certificate. They can also share that certificate across social sites, could be LinkedIn or could be any other social site. And so ideally, healthcare professionals, once they achieve a certificate, they can view, download, and share their own certificate on different social networking sites. So three of these, I would say, additional advantages you get with a healthcare LMS. And with that, I also wanted to walk you through an example or a short demo of what that experience would look like typically for, let's say, a healthcare professional going into an LMS, taking a course, an online course, maybe earning a few credits, and how those credits would then reflect in the user's transcript. So I'm going to walk you through a demo of that. Let me just switch to a different screen here. And Matt, just confirm if you can see my screen. Okay, perfect. So here I'm logged in as as a user, as a learner, and similarly, it could be a use case for a healthcare professional. So here I'm logged into the LMS, and I see a list of courses relative to the healthcare space. For example, patient safety online course. And if I start, it then takes me to the course where I can further engage into the course content, take a few assessments, a feedback survey, and lastly, download a certificate and claim any learning credits as well. So if we go by the flow over here, so here I have a video on patient safety, a couple of videos on patient safety. So if I watch these videos, I can then go to an assessment or a short quiz available within a course. So if I start this attempt, then I see a quiz. It is a time-bound quiz. And let me just go through these responses real quick. So that way we can get through it as quickly as possible. And once I finish my attempt for this assessment, what I can get next is my grades and feedback for my responses. And then you might want to allow any feedback surveys as well for your healthcare professionals so they can submit an evaluation. And it could be a feedback for, say, the course content or the knowledge that they got from this course. So here I'm just taking a short survey and submitting that questionnaire. And that would conclude everything within the course. Lastly, I can download a certificate from here, which is again a fairly simple example of a certificate, but with my name and the scores as well. And then if we go back to this course, I can now claim the learning credits that are available within this course. So if I go to this activity where I can claim credits, and with many healthcare organizations, when they offer training and continuing education, they might have courses which allow for claiming multiple credit types as well, or it could be a single credit type for a course, depending on what the offering is. But with some LMS systems, you will get that flexibility to allow your members, your users, to claim more than one credit type for a particular course or a particular training. So here I have an example of two different credit types. I get one CME as well as one CE. And if I claim that, it then shows that I've successfully claimed for these credits. And that way the course just gets completed overall. We can then go to our profile. And if we go to achievements, and now I can see the credits that I've claimed. It shows that I've received, so I've been issued these credits now, and along with the certificate of completion as well, which is on the bottom. I can then view this certificate, as well as if needed, I can share that certificate on different sites as well. Okay, so that's a fairly simple example of a healthcare professional engaging into online learning, achieving learning credits based on course completion or activity completions, and then they can view that in their transcripts. Now, additionally, when you brought up about integration with BPS and other systems and PARS, the LMS or a healthcare LMS can pretty much automate this process with that integration. So any credits that say a physician or a healthcare professional achieves, those credits can then be automatically passed to a variety of systems, for example, PARS or any other systems as well. Okay, so with that, I'll just conclude this short demo, and Going back to my screen over here. And Matt, can you check if we have any questions anywhere?
Yeah, let me check. I see one here, but that's already been answered. So no, I don't see any questions. I guess we did a fantastic job explaining everything. Yeah, so no other questions, just the one that was answered. So yeah, that will conclude today's webinar. We appreciate you attending and your interest in the topic of how an LMS supports continuing education for healthcare professionals. We hope the information today presented was helpful and will support your training investments and returns. And the webinar will be posted on our website for future on-demand viewing within a couple days. If you'd like to ask any additional questions or continue the conversation from today, we'd be delighted to hear from you. You can use the email address and contact information below to reach out to us. We so appreciate you joining our webinar today, and enjoy the rest of your day.
On that note, I think I would also like to add that we do offer a free trial as well, and that's available on our website. So anyone who's interested, you're free to register for a free trial. It's a 15-day free trial, gives you access to a lot of tools, excellent tools that are available in our system, content authoring, creating courses, and many more. So definitely you can visit our website, MapleLMS.com, and you'll find an option to register for your free trial.
Great.
Right.